Hello guys, I just got done with work. On my way out, I saw all these ambulances standing outside the hospital. I had an idea. I thought I'll show you what is inside an US ambulance. So I'm teaching you all these steps in my channel to make sure that you don't land up over here and you don't need all these bus services without a ticket. So there is a driver seat and a passenger seat. Usually there is an EMT, emergency medical technician, and a paramedic sitting over here. My friend 𝒊𝒂𝒂𝒔, looking at all this, he says, I love to go on this van for a long drive because it looks like they have a very good music system. So in the United States, if you have any emergency, you call 911, the ambulance comes in, triages you regarding which kind of symptoms that you have, and then they will take you to the hospital nearby as soon as possible. So we are going to go inside an ambulance. So this is supposed to be the bed. And then, the paramedics will sit over here who can help the patient. And the most important thing over here is this defibrillator machine. Look at this. This is what we call as CPR machine. We see them in the movies. In the movies, they make it look like as if it is an iron box machine. And as soon as you press the machine, all the heroes will jump up. Nothing like that will happen on real life. Okay, so it's usually there is a charge cable over here, and then based on the analysis whether the patient was having any pulse, what kind of rhythm they have, machine will determine whether to shock the patient or not, so that they can bring the heart rhythm to normal. This is the most basic in an ambulance. I want to make a very important point here that if you see any person unconscious right in front of you, please check for pulse. If there is no pulse, right away start chest compressions, at least 30 compressions, 2 inches depth right in this area for a rate of 100 to 120 compressions per minute. So once you turn it on, you connect the leads, it will show you the rhythm, and then once the device says that okay, it is ready to shock, you see this red button over here, they click that and then the shock is applied to the patient's heart. So these are all the breathing machines. Look at that, there is a nebulizer, there is a nasal cannula. I'll open it and I'll show it to you. So look at this, it's a nasal mask, and this is through which you connected this to this oxygen flow here. And then goes over the patient nose. My patient 𝒂𝒂𝒂𝒔 had a mild asthma attack and he wanted an ambulance, and we put him a nebulizer. While breathing through the machine, he's asking me whether you have a USB Type-C charger for iPhone. I was like, why da? He's like, I need to call my ex-girlfriend Tirupura Sundari one last time. I will never let this happen to my friend 𝒊𝒂𝒂𝒔. This is one of the most important cabinets here in the ambulance. This is your ET tubes. This is where when the patient is not breathing, they will secure the airway. So look at this tube. This tube goes into the lungs, linked to the trachea in case if they are not able to breathe on their own, so that this can be connected to a ventilator, which will provide artificial oxygen to the patient until the patient recovers. And look at this, all these are IV needles. So most of the patients gets an IV line right away. Look at the needle that goes through the IV, and then they secure IV line so that they can give glucose, they can give medications, they can give whatever they want based on patient's condition, so that the whole goal is to get the patient right back as soon as possible. So look at this, there is a locker over here. This is where they store all the opioids, morphine, all these opioid medications where it requires very strict prescription. They have to exactly calculate how much amount of medications that they took in the morning and how much amount of medication that they gave to the patient. So they monitor this extremely carefully given the opioid abuse here in the United States. And the most important medication, one more thing that you need to remember, is epinephrine. One of the most important medication here in this ambulance is called epinephrine. That's what you give to people who are allergic. For example, I had a patient who was allergic to peanuts. He didn't even know that. He was eating peanuts. All of a sudden, he started swelling up. His tongue got bigger. His face got really pale, and his breathing got very difficult. It is absolutely important that we give this epinephrine injection right away. Usually, it comes as an EpiPen, and they inject on the thigh. And sometimes they give it on the IV as well. So we gave the EpiPen injection and all his allergic symptoms were completely gone. So when he was a little bit more normal, when his symptoms subsided, he's asking the ambulance driver, on the way to the hospital, can you drop by the Starbucks to get one Frappuccino? I'm showing all this to you guys not to scare you, but to make sure that you follow my channel, follow the tips, at least implement 50% of what is discussed in the channel. I guarantee you that you will never be in this ambulance ever in your life. That's the goal.